Welcome back, Titans. Today we were talking about Norepinephrine drips. In the previous video, we went over Norepinephrine, mechanism of action, the indications, contraindications, and everything, so check that out. Today we are not going too deep into the details of Norepinephrine except for how to mix it if we don't have a pre-mixed bag and how we're going to deliver it to our patients. So Nancy Caroline, let's start off with the dose, is 0.1 to 0.5 micrograms per kilogram per minute. Much like the other medications, like a dopamine drip or an epi drip, this is one where we're going to mix and we're going to titrate up to effect. Not like lactated ringers or a normal saline where you're specifically just giving a volume bolus. So let's jump right into it. So let's say we wanted a 4 microgram per ml solution in our bag. That's what we want for a concentration. We're also going to do this two different ways. We're going to do it with a 1,000 bag. We're also going to do it with a 250 bag, but we're going to start with this first. So we have our Norepinephrine over here, 4 milligrams, and we have our starting concentration of 4 micrograms per ml. So how do I get that? So anytime you want to identify the amount of drug inside of a bag, all I have to do is take my 4,000 micrograms, and I'm going to divide it by my volume, which is 1,000 mLs. So if we divide 4,000 by 1,000, it's obviously going to be 4. So that's where our 4 micrograms per ml comes from. We also know that 1 milligram is equal to 1,000 micrograms. 1 milligram is 1,000 micrograms. So if I have 4,000 micrograms, I know it's equal to 4 milligrams. So in our vial, we are going to put the entirety into our 1,000 bag, and that's going to give us our appropriate concentration for this example, 4 micrograms for every ml. So let's plug it all in and give our patient some Norepinephrine. So starting off, we're going to start off with the lowest dose, which is going to be 0.1 mics per key per minute. Let's use our patient as, let's say, 100 kilograms. Make it easy to start. So when we have our 100 kilogram patient, the first thing we're going to do is plug our kilograms into our equation. So we're going to do 100 kilograms to start, and we're going to multiply that by 0.1. Now, you can either do it in a calculator, but we also know that 100 kilograms written out times our 0.1. All we would have to do is move our decimal place over one spot because it's tenths to equal our 10. This is our micrograms that we're going to be starting per minute, is 10 micrograms. So the next step is I'm going to take my 10 micrograms. We're going to take our 10 micrograms. I'm going to divide it by our 4 because our concentration was 4 mics per ml. So once I do that, that's going to give me 0.25. So remember, this is how much medication we're going to give, but now we're trying to find out what our drips are going to be, how many drops a minute I want to achieve. So we have our 10 micrograms. That's our dose that we want. We're going to divide it by the concentration, which is 4, to give us 0.25. Then we're going to take our 0.25, simply multiply by our drip set, which is 10 drops a minute, and it's going to give us 25 drops a minute. So to achieve my 10 mics, I'm going to start my drip at 25 drops a minute. So let's try it with a 250 bag. Let's say we're going to continue to use the same 4 milligrams that we had before, which we know is 4,000 micrograms. Now we just have a smaller bag. Anytime you have the same amount of medication in a smaller volume, our concentration is going to go up. So let's put our 4,000 micrograms or 4 milligrams inside of our 1,000 bag. And we're going to divide it to find the appropriate concentration. So now if I divide 4,000 micrograms for my mLs, now my concentration is going to be 16 micrograms for every ml. Lower volume with the same amount of medication, our concentration is going to go up. So let's plug it in for our patient. Let's use our same 100 kilogram patient. And it doesn't matter how many kilograms they are. You can always type in 80 keys, 115 keys, whatever your patient's weight may be, after we've done our conversion from pounds to keys. So 100 kilogram patient, first thing we're going to do is take our 100 kilograms and we're going to multiply it by our dose, which is 0.1 mics per minute. We're going to plug that in. We know that it's going to be 10 micrograms. The dose isn't changing. We still want that same 10 micrograms. The only thing that's changing is the amount of volume that we have and that our concentration went up. So we're still trying to achieve our 10 mics, okay? So the only difference is now we're going to take our 10 micrograms and now we're going to divide by 16 because our concentration changed. So our 16 mics, that's going to give us 0.625, a little bit different. We're going to follow the same process, take our 0.625, and I'm going to multiply it by my drip set that I'm using, which is a 10 drop set here. We're going to multiply that 10, and that's going to give us 6.25 drops per minute. We can round down, let's call it 6 drops a minute. But if you look at the difference, we have 4 times the amount of medication, 4 times the amount of concentration as our 1,000 bag. If you did 6.25 times 4, it's going to give us our previous drops with our 1,000 bag, which was 25. So it's basically just a quarter of it. So hope this helps. Always cross-check your medications and be safe.